Every day at the Medicare Rights Center's National Hotline, we hear straight from the source about the problems people are facing, especially with the Medicare prescription drug program. And we listen carefully because their stories help us make Medicare even more effective for consumers.
Yes, that would be what's called a Medicare savings program to help you save on your Medicare premium.
We help one person at a time on our hotline, but our work doesn't stop there. Our dedicated staff and volunteers identify issues and trends, which we use to develop educational materials and programs that reach hundreds of thousands of people across the country. We also help people with Medicare through policy initiatives and reforms. We're in touch with lawmakers in Washington, Albany, and other states, and we advocate for positive change in Medicare.
Through client advocacy, education, and policy initiatives, we maximize our ability to help our clients and improve the Medicare program. By helping one person at a time, we can and do help all. I think the best way to illustrate how effective we are is to track one key issue as it travels through our organization. We'll watch it as it moves from our hotline to our education and policy departments and results in positive change. So let's take a closer look at the Medicare prescription drug benefit and its infamous gap in coverage, commonly known as the donut hole.
It's not this donut hole, it's the gap in Medicare drug coverage that millions of people with Medicare reach every year. People with Medicare have coverage until they and their insurance plan together spend $2,830 on drugs. After that, they have absolutely no coverage until they spend $3,610 more out of their own pocket. At that point, their coverage resumes. No other prescription drug coverage in the country operates like this. The donut hole has been a devastating and persistent problem for millions of people, and it's precisely the kind of problem that Medicare Rights puts its energy behind to fight and eliminate.
Time and time again, we hear horror stories on our hotline from callers who are left adrift and sinking in the donut hole. Our hotline is the very heart of our organization. It's where we answer tens of thousands of calls each year from consumers, caregivers, and professionals. And it's the first place we hear about how Medicare is working or is not working for those who depend on it.
One of our callers, I'll call her Mary, was referred to our office because she had fallen into the donut hole and was having difficulties paying for her prescription drugs. She could barely make ends meet. Mary, who is 88 years old, had been enrolled in a program in the past that paid her monthly Medicare premium. But due to her poor eyesight and her health, she was not able to recertify in a timely manner. With my help, she was able to get reinstated in the program, and we also enrolled her in 2 more programs that paid for her prescription drugs and helped her climb out of the donut hole. After helping Mary, we discovered that her sister, who is 86 years old, was in the same situation, so we assisted her as well. Today, both sisters are able to access their prescription drugs for just a few dollars a month. And Mary told me, "Sin tu ayuda, no sé qué mi hermana y yo hubiéramos hecho."
I've had the pleasure of being a volunteer here at the Medicare Rights Center for nearly 15 years. One of my responsibilities is to record information about our hotline calls and then enter it into our client database. So I can honestly tell you that a lot of people are falling into the donut hole and suffering badly. Luckily, we're able to help some of them, but for others, there has been no good solution. Some of our callers have been forced to skip doses, split pills, or stop taking their medication altogether.
From New York now is Joseph Baker. He is the president of the Medicare Rights Center, here to talk about Medicare Part D.
Part D prescription drug plan has really been a big success in getting folks access, people with Medicare, access to prescription drug care. Of course, there have been gaps in it, the infamous donut hole.
We know that the donut hole is crushing for the people in it. So our job in the education department is to teach people how to negotiate and survive it. We do this through educational materials and programs like Seniors Out Speaking on Medicare, where we train seniors who lead presentations about Medicare in their own communities to groups of their peers. On our award-winning website, Medicare Interactive, people can get comprehensive advice and creative solutions with just the click of a mouse. Medicare Interactive logs over 400,000 visits a year from consumers and the professionals who help them.
At the same time that our education department works to demystify the Medicare program, our policy team is hard at work in Washington, working to change the Medicare program to be more responsive to its consumers. Medicare Rights has worked to close the donut hole since Medicare prescription drug coverage started in 2006. We've taken the stories and data from our hotline and educated policymakers about the donut hole, how it prevents many from getting the care they need. We've also mobilized consumers, telling their own stories directly to their elected representatives through the Take Action section of our website. And we have taken to the airwaves to expose the problem and suggest solutions.
As a member of the Medicare Rights Board, I am proud that we not only help individual clients, but also carry their voices and concerns to Congress and other policymakers to change Medicare for the better. Last year, for example, we coordinated our efforts with other advocacy groups and worked tirelessly to make sure health reform would close the donut hole. And as a team, we did it. When health reform passed, it included a phase-out of the donut hole. Help came immediately in 2010 in the form of a $250 rebate check for consumers who reached the donut hole. And next year, in 2011, consumers in the donut hole will receive a 50% discount on brand name drugs and a 7% discount on generics. By 2020, the donut hole will be totally eliminated.
We're proud of the role we played in eliminating the donut hole. And we celebrated for a moment, and then we got right back to work. We're going to continue to work to make sure people with Medicare are getting the drug discounts they're entitled to. And there are a whole host of other issues that our clients have pointed us to and that we need to work on. Over the next year, Medicare will continue to change because of health reform implementation, and it will be part of the larger national conversation about deficit reduction. The elimination of the donut hole is a case study of how Medicare rights can and has been most effective. We learn about the problems individual clients are facing. We help them solve those problems. And then we educate thousands of others about how to avoid or minimize those problems. Ultimately, our clients' voices help us propose solutions to policymakers so that the 50 million people with Medicare will not face the same problem in the future. By helping one, we can help all.